Hi, welcome to the Fit and Healthy Today show. Today our topic matter is on lupus. Had a lot of people coming in last week with lupus diagnosis from their doctor, and I thought it would be a helpful thing to identify perhaps some of the causes. The symptoms are pretty clear, at least to those who have it, but for those of us who don't, to kind of give you some idea of what to look for, and then some of the supplements and diet that may be helpful in the treatment or reduction of symptoms of lupus. First of all, lupus is an autoimmune disorder, and in all autoimmune disorders, what happens is the body has a difficult time identifying friend from foe, and so it'll attack healthy tissues, causing inflammation and pain. Now, the problem with lupus is it usually arises in age 40 and later, so we sometimes think that maybe there may be some hormones or something related in that regard, but women age 40 and above, 90% of the sufferers are women, not men, and you are 3 times more likely to sustain lupus if you're an Afro-American woman or a woman of Afro-American descent. There's 2 different kinds that we deal with. One is just more inflammation, red skin across the face, and you'll see it sometimes additional on the forehead and scalp, and they'll have this kind of red kind of look to it. Now the systemic is the same as above, but literally the tissues, the body attacks tissues in the joints and muscles, and it creates very similar pain to like rheumatoid arthritis. Now there are tests that can be done for this now that are much more accurate than the tests that were in the past that can check for particular antibodies that seem to be more prevalent in lupus. Much easier to diagnose. Now when we're talking about symptoms, it's interesting because they vary from person to person depending on what body part is being attacked and what overall physical condition you are in, your hormones, your diet, a lot of different things. But the most common symptoms, besides the red face and the attacking of the joints and the muscle tissues, are fever, fatigue, weight loss. You get very sun sensitive, so the areas that are red across the top will take on like a burned type of a look, and if you are in the sun, it will burn much more readily. You're susceptible to other diseases because your immune system doesn't properly respond, therefore it can trigger your body can't identify from foe properly. It can enhance other diseases such as cancer and other viral and bacterial types of infections. We also see a continual reoccurring of bladder infections because once again, most of which are bacterial caused, are difficult for the body to identify. When we look at the causes, there's not any one particular cause that the medical establishment has been able to say this causes lupus. But we have to kind of look at who the lupus is attacking, and it's generally, like I said, women age 40 and above. So when we look at that, you got to kind of wonder if there isn't some type of hormonal type of thing going on here. We've got such an estrogen dominant and progesterone deficient environment. We've got all these xenoestrogens from pesticides and plastics and herbicides and fertilizers that us women end up being extremely what are called xenoestrogen dominant. And so as we go through perimenopause or menopause, our progesterone levels fall, so therefore it makes us much higher ratio of estrogens to progesterone, which we kind of wonder if that isn't one of the contributing factors to this particular disease. We're not sure whether or not viruses, bacteria, or parasites might be the trigger. There was some research on something called black walnut hulls, and it was found to be in folklore a quite effective treatment against lupus. So it makes you wonder, and since black walnuts we typically use to treat parasitical infections, you kind of wonder if maybe that may be a contributing factor in addition to all these xenoestrogens causing so much inflammation, RNA, DNA damage. Now, chemicals as well, which are not necessarily just estrogenic, but alter and change our RNA, DNA, or affect our immunoresponse, I believe could also be a contributing factor as well. Heavy metals, boy, nervous system response, immune system response, and I'll tell you that good old fluoride that everybody seems to be trying to push on everybody to strengthen teeth, which actually, based upon some of the research Ralph has given, actually cause your teeth to crumble. You know, mercury from the fillings. I had mercury poisoning from my fillings starting to leak after 30 years after they were put in my mouth. Anything that seems to cause digestion issues or digestion problems, gluten intolerance, food allergies, anything, remember 80% of your immune is down in your bowel. So therefore, if you've got diverticulosis, diverticulitis, IBS, digestion issues, heavy metals cause digestion issues, food allergies cause digestion issues, your immune system is not going to respond in a proper fashion, so that can be a contributing factor. Deficiency of hormones, I already addressed progesterone, but there are other hormones that these xenoestrogens can block, including DHEA and testosterone, particularly in males, or contribute to a conversion of testosterone into dihydrotestosterone. And then constipation and diarrhea. When a person has a constant issue with not being able to properly detox or eliminate, and probably that's what I probably should have said here, you hold on a lot of toxins, your body doesn't get rid of them, and guess what? Your immune system's not so good, you become toxic, and you become vulnerable to all autoimmune disorders. When we look at diet, now I should just photocopy because it seems like the diet is just about the same for just about every disorder, and so therefore, you know, really take this to heart. And later on in the second part of the show, I'll be mentioning some different types of salads and things that you can use to help detox the body with. But when you're talking about diet, it is very, very important when you have lupus to go organic. And through the literature that I researched and read throughout the last week, the organic, because no chemicals, no pesticides, herbicides, petrochemicals, no chemical. You want to go as much chemical and toxin free as you possibly can anytime you have an autoimmune disorder. So organic fruits and vegetables high in fiber allow you to eliminate. They also give you nutrients, oxygenate the blood, alkali the blood. And that was a big issue too as far as lupus is concerned. Oftentimes people are extremely acidic. Their bodies ache and hurt. Their face aches and hurts. And when you have those issues of inflammation, anytime you have an acidic diet, sugar, flour, pasta, starches, the kinds of things that I have on here that you want to eliminate, you're going to get acidic. So alkaline fruits and vegetables with primarily plant source proteins with lupus. Now there are some studies out on lupus with animal source proteins, and we already know animal source proteins can, other than fish, because the fish oils are anti-inflammatory, but when you're talking about beef, pork, and chicken, those types of saturated fats are extremely inflammatory. And in lupus patients, there was some good studies done, and we'll talk about it. When you eliminate those particularly from the diet, the severity of the symptoms reduced. So truly, I know a lot of people may not want to hear this, but a vegetarian diet for someone who has lupus is kind of a must. If you do chicken, make sure it is chicken breast, so it's extremely lean. When we're talking about being able to eliminate as well too, we need to drink a lot of water. Every 2 hours, everybody should be drinking 8 ounces of water every 2 hours, because they tell us that we need 64 ounces of water. And I think most people don't get it. On good days I will, on most days, sometimes I only get half that. So make a conscious effort if you suffer from lupus or are healthy to get more water. Now, there are certain foods that are very rich in sulfur that have an affinity to help give some protection of the joints. And that includes onions, garlic, and asparagus. I know most people are like, asparagus, it makes me smell. Well, it is probably one of the highest sulfur-containing vegetables in addition to onions and garlic that you can do. And it's very alkaline, cleansing for the body. When you're talking about, and we discussed a little earlier about bowel inflammation and how when your bowel isn't operating right, 80% of your immune system is right down in here. You've got to eliminate the foods that you're allergic to. And having one of those good blood works with the 99 food panel to determine what you're allergic to is pretty paramount in anybody who suffers from autoimmune disorders or eczema or psoriasis or any of that type of, those types of disorders, in order to reduce that inflammation down. If you don't do that, you're missing a key element in trying to reduce inflammatory response. Supplements are many, but I wrote the ones down that had the best research and the most hope for reducing symptoms. There was a pretty phenomenal study done on fish oil. Now, mind you, we're talking clean, cold water fish oil sources, not from your local department store or grocery store. We need a good, clean, mercury, PCP, contaminant-free fish oil, a tablespoon to 2 tablespoons per day. In the study, double-blind placebo, 78% of the lupus sufferers sustained significant reduction in symptoms over a 12-week period of time with taking this amount of fish oil. GLA, which this means about 2,800 milligrams of GLA. It's a type of fatty acid that we'll find in nuts. We'll find it in borage oil, evening primrose oil. What it does is it helps with hormonal stability, which we believe is a contributing factor for lupus. And in addition to it, also helps reduce inflammation in combination with fish oil. These are an excellent combination for inflammation. Beta-1,3-glucan, 500 milligrams a day. It better allows the body to identify friend from foe, whether it's lupus or other things. I take it because everybody walks into my store with measles, whooping cough, you name it, flus, every infection known to man, pneumonia, and I don't catch it. I supplement very well, but one of the key things I think that I have found works very well in the research supports is the beta-1,3-glucan. Once again, when autoimmune disorders, your body has a difficult time identifying friend from foe, the beta-glucan can aid and abet your ability to identify friend from foe. DHEA, there's some clinical studies, I believe out of the Mayo Clinic, and I know this seems like a high dosage for women, but 50 to 200 milligrams under the supervision of a doctor, because DHEA is a precursor to estrogens, progesterone, testosterone, and so apparently oftentimes people who have lupus have a difficult time with converting DHEA into these forms, so high dosages are necessary. MSM. Now, I know most people think, oh my God, I've got to take 2 to 8 of those 1,000 milligram pills per day. Yeah, do it up until the point of you get loose stools, because that MSM, those sulfur compounds that we talked about earlier, really help, based upon clinical data, with lupus, particularly in systemic lupus that attacks the joints. A reduction of inflammation and better usage of the collagen. Now, I don't have it down here, but your vitamin C is very important for your immunal response and your collagen matrix as well, too. So that in conjunction with MSM is very helpful. Digestive enzymes. People who have lupus have problems breaking down and absorbing a lot of their nutrients. And enzymes can help pre-digest, break down the food so that the intestinal tract can better absorb them. In addition, they're very anti-inflammatory and ease up on the stress on the body, particularly on the liver and the pancreatic gallbladder in production of enzymes. Turmeric, double-blind placebos on turmeric, and I know even Dr. Rosenfeld on Fox News has mentioned that 500 milligrams of turmeric extract, mind you, not the spice, but the extract, twice a day wasn't as nearly as effective anti-inflammatory as your typical Mobix or Celebrex, which we now know contributes majorly to heart valve, the eating up of them. One of my customers came in today and she was taking ibuprofen for the last